Well, so ladies and gentlemen, without any further ado, we are very lucky that we've actually been joined by somebody who's actually the head and support of coordination in Pakistan Mobile Clinic Project. He's none other Mr. Ghulam Muhyiddin. Hello, assalamu alaikum, good morning.
Walaikum assalam and good morning, Shehzad.
Thank you very much for joining us. It's wonderful to have you. And alongside him, ladies and gentlemen, we have somebody from a brother country, Turkey.
Thanks.
He's none other than Mr. Mujahid Kilik. He's the field coordinator, Pakistan Mobile Clinic Project. Hello, assalamu alaikum. How are you?
Walaikum salam. I am fine. I hope you are fine as
Absolutely
well.
perfect. Thank you very much for joining us. It's wonderful to have you. But let me get my conversation started with Mr. Ghulam over here. So, sir, how was this idea conceived in the first place? Why was there this need to conceive such an idea? And why mobile clinics? Why not proper clinics at proper places?
Thank you. Thank you, Shehzad. First of all, I would like to thank Pakistan Television, our national TV, to give this opportunity to bring our all ideas in front of the nation and to the public. Basically, as you mentioned earlier, our Prime Minister of Pakistan, he's committed to provide the quality health services on the doors of Pakistani nations, and for this these struggles and the things are going on. What I'm going to tell you about this unique idea, because why I'm telling you that the unique idea is that the first time it is launched within Pakistan to bring this mobile clinic for the people who are living in remote areas and who do not have open access to the government hospitals or the nearby health facilities, even in the area which is not fully developed by certain reason or maybe neglected by some of the reason.
Okay.
Then this mobile clinic is basically, as it's mentioned, that it's a mobile clinic, so it moved to the doorstep of the people, like in the country. So this mobile clinic normally is sponsored by the Islamic Development Bank. We are really grateful to the Islamic Development Bank, who really are taking a very great initiative within Pakistan. And although Islamic Development Bank is doing so many projects in this country, but particularly the significance of this project is that it's working on the basic primary health of the people of Pakistan to improve their quality and the health facilities even in the country. So the funded by the Islamic Development Bank and support by the King Abdullah Foundation, and this is not only for the Pakistan. Islamic Development Bank have its own initiative targets for the 7 countries, and Pakistan is one of the country among all these 7 countries. And in other countries we have like Bangladesh, Sri Lanka, we have Yemen, Afghanistan, Tajikistan, Kyrgyzstan, and India. These are total 75 mobile clinics that will come to the final conclusion. But in Pakistan, it is decided in the first phase we will go with 8 mobile clinics, and for the in second phase the 7 more will come to Pakistan. So initially we are now the 8 clinics all deployed, and 6 are our clinical containers and the 2 are surgical containers. And we are working in Khyber Pakhtunkhwa, in the remote areas where the people have less facility and less approach to the government hospitals or some dispensaries or basic health units like this. And the same on the 2 districts of Sindh. That's one of the district is Umarkot, and the second district is Tharparkar. So that's like how we are moving. The response is tremendous response coming from the people. The people are getting benefited. Even in the area, we are so proud to offer these all services free of cost to the people who never thought even to think to get some a small relief from the any
Well,
side.
that's great and
That's-
superb, and we're definitely going to dig in deeper as well. But Shiza right now, ladies and gentlemen, has got a very important question to
Yeah,
ask. Go on.
absolutely. That's actually brilliant, because Shazad, if you remember all the health shows that we've spoken about, we did discuss that we do need mobile clinics are the need of the hour, because when we're talking about vulnerable segments of the society, like women or like children or like elder people who do not really have the access to go to private or even public clinics, this is the answer. From what I have read, you guys are offering primary health services along with diagnostic services. You tell me what else is on the list for people to, what is the
What
right
kind
way
of
to say?
diseases can be treated with such mobile clinics?
Right. And are we also going to curative procedure as well?
Yeah, Mr. Mujahid.
Brother Min has a proper
Okay.
answer
Okay.
for this
Oh, yeah.
question.
If you talk about the primary healthcare, then the primary healthcare mean the elements which comes under the primary curative, and the small diseases, which is like the people who are suffering from small diseases in their area where they couldn't find any resources or couldn't find any suitable place even to go for diagnosis, or for small things. For example, if we have a number of stories and number of incidents what we found in the area when the people were suffering from small diabetes or small blood pressure, like even they were not aware about that one. How she or he are feeling like that. And the first time when they approached this mobile clinic, when the mobile clinic approached on their doorstep, they arrived, they get themselves, they went to the doctor diagnosed. The first time he or she they know that yes, I am with the diabetes. And what is diabetes? Then the staff is there to give them awareness, to give them like on a daily basis, because when they arrive there, it is not only only the treatment which is going on, but also the team which is deployed over there, they are also giving them awareness to just to stop that, because we believe on that. Instead of curative, why not to go for preventive measure also?
Alright,
Exactly.
So the awareness is also the part of this mobile clinic project. Yes.
Okay.
And let me just move on to Mujahid Sahab over here. So now, ladies and gentlemen, obviously, I think Mr. Mohiuddin Mr. Ghulam has actually given us quite a lot of information about it. But since you are the field coordinator, and it obviously needs to be approved by you, which particular areas are you going to look into, or probably the mobile clinics will be going to. Now, how are we deciding that, okay, 4 districts of Khyber Pakhtunkhwa, 2 districts of Sindh? Is it based on the kind of research we have got that there are more sick people or more people suffering from cholesterol or other diseases? Or can we even call the mobile clinic to our doorstep? Or is it just the mobile clinic appearing in front of us, and that's the time when we are going to get a chance to get ourselves treated?
First of all, I want to thank you all for
you.
having us to introduce our works and introduce our mobile clinic project here. We have actually selection criteria of those, districts.
Okay.
First, we actually makes research about the districts, regions, about the facility of the health and population of the area, and also roads also are important for us, because as you can imagine, we are moving such a huge containers.
Right.
So roads also must be proper. So we actually select those districts with the collaboration of provincial governments, KP and Sindh provincial governments. We have both district committees and provincial committees. Consist of provincial and district officials, DHOs, provincial health ministry. We actually select those districts with the help of officials of Pakistan.
Okay, well, that's good.
And in addition, as Mujahid mentioned, in addition to that, when the study was going on, basically it's a big theme on the back of this whole project.
Right.
Before launching this project, the team arrived from Turkey, team arrived from Jeddah, team arrived from even the Pakistani official, all stakeholders, they sit together, they went for a certain kind of basic assessment, and they visited some of the districts. And 4 parts were considered to select these all districts from the Pakistan.
Okay.
The major thing was the poverty index.
All right.
What's the poverty index of that particular district?
So important.
Yes, exactly. Then it was the second one was just to find the accessibility of that, whether the people can find some government infrastructure regarding the hospitals,
Okay.
BHUs or something like that. And the third one was whether this area is suitable for such mobile clinic. Because it's a huge convoy, it's a huge traffic. Like in Pakistan, normally we use 40 feet of trucks, 40 feet. Normally the maximum size of the container is 40 feet.
Right.
But it's 50 feet long, and even the width is more than the standard width which is being used in Pakistan.
Okay.
Right.
So it's also it's a big challenge for Pakistan to approach some of this area. We are interested in even in GB. We are interested in AJK. We are interested in some other hilly areas, which is even the people are in more deprived condition. But again, we are thinking over that how to challenge, how to counter this challenge, and to reach the people with the help of this one.
Wow.
So poverty index and the assessment, the road assessment, and the availability of the facilities, whether it's available in that, and all components were considered before selection of these districts. And yes, as Mujahid mentioned, the government stakeholders, they all recommendation and their advices were always we consider that, and based on that we selected these 4 districts.
That's brilliant. But here's the thing, this is a very basic question, but I feel like it needs to be out there as well for people to understand the type of services that you're providing, the quality of people that are working with you. What incentives are you guys offering to the doctors to come on board on these mobile units and, go to these far-flung areas and treat the people in need?
And does it get a little difficult to convince the doctors to as well to take them out of their clinics and then?
Absolutely. I think you raise a very important question, particularly in remote areas where the doctors and nurses and even paramedic staff they are reluctant even to work in that. It's a challenge. Being a head of support of the organization, I'm facing the same challenge. Yes, exactly. But again, as you mentioned. Basically the organization is providing such type of incentive to the doctors and paramedical staff, and the main thing is the sense of ownership of that they are serving for the people of their own motherland. They are serving for the people for which they took oath to be to serve for the nation. And honestly speaking, in the beginning, we were facing such challenge, but now we have number of people who are waiting for such opportunity to serve for these. I have I have a database of such. Even we have volunteers in our row. We have the database of the volunteers also. I'm so happy. I'm glad.
Why don't you smile when you are happy? You should smile too as well.
Exactly. We are providing them pick and drop from their home to their to the offices.
So every facility is being provided.
Yeah, boarding, lodging, even whatever they feel comfortable. They feel comfortable at the job site. We provide them.
I think that's great. That's great. And I know that Mr. Ghulam Muhyiddin Saab is equally excited as we are as well. But I think Shizaj that you've actually asked a question from the doctor's perspective, but I now want to ask Mr. Mujahid over here from the communities, how are the communities actually responding to such an intervention? Are they very welcoming, or are they like, probably we don't know whether the doctors are good enough or not? So how are the communities responding?
It is actually a unique project, unique service which we are providing in those areas. Actually, we were not expecting, such high level acceptance from the communities. We actually are surprised by that, but honestly speaking, we got tremendous response from the communities. Actually, I will come to that, but I want to also tell this now. Usually, we put our clinics in one place for 3 months. So when we move to another district, another place, so they usually want us to stay longer than 3 months. So people are welcoming us wherever we go. So this is actually, makes us very happy.
Of course, helping people does make people happy as well. But when we're talking about such an intervention, Shazad, this is humanitarian, right? While of course there are some limited resources, but you really have to think with a humanly mind to, you know, how to deal with all of this.
Yeah, just like mine.
Yeah, exactly. The point of saying this is there must be some objective for you guys to, you know, reach. There must be a certain number for you guys to reach in terms of, you know, this is what we need to do by the end of phase 1. For example, are you guys looking for, let's say we'll treat 85 people, but the 86th person, well, he can do whatever he wants to because we just want you to treat 85. So is there such a thing that we're looking on to?
Yes, actually now in our mobile clinics, more than 75,000 patients have been treated so far. Yes.
With the help of 8 mobile clinics only?
Yes,
That's
8 mobile
amazing.
clinics. Yes. To be specific, out of these numbers, nearly 27,000 was children, 34,000 female, and 16,000 male. As you can realize that majority of the patients is female. Inshallah, yeah, normally our target was to reach 840,000 patients to reach this number of patients by the end of the project. But you know, we actually receive patients every day beyond our expectations.
Right.
So now probably we will reach 1 million patients, inshallah, by the end of the project through our mobile clinics.
And that's great. And you know, ladies and gentlemen, I think that for me to know that, you know, that there are people in remote areas who are ill and now they're recovering, and I think that it's a very good feeling as well.
Exactly.
But since we are very short on time, so there's one last thing which I would want to ask, and that is, what would be the exit strategy? I mean, imagine, so the mobile clinics came in, they went, they treated people, and now they go back again. So, you know, what happens, you know, because the treatment needs to continue, the clinics need to be there for people. This is something which we realize now, because the number of patients was tremendously higher than what we thought. So how are we going to exit with this program and then come back with a better one?
Yes, the actually initial duration of the project is 5 years.
Okay.
And I mean the first phase of the project, as brother Mr. Gulamuddin also explained that after 5 years, inshallah, after we complete 5 years, we actually those mobile clinics and project will be handed over to government of Pakistan, along with all infrastructure we built and developed, and database of patients and all medical equipments. So that they can continue to provide these health services to needy people of Pakistan.
Wow, that's brilliant. So very quickly, before we wrap up this segment, there's one more thing, and that is, since these are mobile clinics and they go different places, and there's a lot of dust and there's a lot of problem, a lot of people do not wash hands in those areas as well. So how do we look after the hygiene? Or do we sterilize the entire clinic? How does that work? Because I think that's something really to worry about as well.
Yeah, Shehzad, I think you mentioned this very important area. Normally, but we have very strict SOPs on that. We have operational manual and they follow this SOP. We are also considering the importance of this health and hygiene promotion, just to raise the awareness in the people, because if you go for preventive measure, even you can reduce the number of patients. You all will agree with it. As Mujahid mentioned, that this about this database. This database will also help the government even to build some policies about the particular for the particular district and particular areas, such type of diseases or such type of symptoms that the people are facing over there. So this will also be helpful for the government as well. Yes,
and that's great. So thank you very much, gentlemen, for being with us. It was wonderful to have you today.
Thank you for having us.
Thank you.
All right, ladies and gentlemen, we spoke about how some physically vulnerable segment of the society needs some sort of intervention, right? And this is what it is, Pakistan Mobile Clinic. But when we're talking about these segments as well, Shahzad, women and elder people actually can communicate what is going on with them. Of course, while they are physically vulnerable, but at least they can, you know, tell some persons what is wrong with them and everything. But in terms of children with such a weak immunity system as well, and no way to communicate what they might be feeling and what not, I feel like they are the most vulnerable, and we need to talk about them in detail, specifically.
And ladies and gentlemen, before we go towards a short break, there's this one small thing which I would rather love to say it in Urdu, ke khawatino hazrat, पाकिस्तान मोबाइल क्लिनिक का आगाज़ किया जा चुका है पिछले साल से। खैबर पख्तूनख्वा के 4 डिस्ट्रिक्ट में और सिंध के 2 डिस्ट्रिक्ट में ये मोबाइल क्लिनिक्स जा रहे हैं और लोगों को इलाज मुहैया कर रहे हैं। अगर आपका ताल्लुक भी इन्हीं किसी डिस्ट्रिक्ट्स के साथ है तो प्लीज़ कोशिश कीजिए कि आप इनका नंबर इंटरनेट से ढूंढ लीजिए और आप इनको बता भी सकते हैं। तो व्हेनेवर दे आर देयर, प्लीज़ मेक श्योर कि आप जाइए और अपना इलाज करवाइए और तंदुरुस्त रहिए।
Heading out to a very short break. Stay tuned. Good morning.